Hey Sharif, first I want to thank you for trusting us with your dental care. We truly don't take that lightly. Our focus is biomimetic dentistry, which means we repair teeth in a way that mimics how they were naturally designed, bonding and strengthening what you still have instead of automatically cutting teeth down for crowns or jumping to root canals. The goal is to help teeth last longer with fewer procedures, less time, and often less cost, while preserving as much natural tooth as possible. If you know someone who's been told they need a crown or root canal, we'd love the opportunity to take a second look. Sometimes there's a more conservative option, and referrals like yours are the highest compliment we receive. Kind of go and do kind of your case here. This was kind of the x-ray, kind of starting off some things that, we had kind of were testing was, this tooth that you had the crown on. I'll kind of point out some things here that I think might be going on, but we'll just kind of have to see. I'm assuming that you probably had a crack in this tooth that warranted the crown. You can kind of see right here, that's probably, maybe where that crack was. It's impossible to say unless you were to take the crown off if that crack was fully removed. You're also kind of dealing with kind of a seal right here where if this seal is a little compromised, it can affect, that fluid flow as it kind of comes in and out of the tooth right there. This tooth has responded normal to cold, which is good. There's a little kind of shadowing around this root that could be indicative of an infection. There's actually kind of some density around this root that is, and so I could see where possibly this tooth, might not feel 100%. I guess the question is, what do we do about it? Do we accept that? Or, do we try to remedy that? I think your options are going to be traditionally, no particular order, maybe remove the crown, make sure it's sealed properly and any cracks are removed. Root canal, obviously, or remove the tooth, which I don't know. I just don't really, I don't know if the symptoms right now warrant that. That'd be kind of up to you. But this is the tooth next to it here that we kind of worked on there. And so this is just that initial kind of presentation. You can kind of tell you probably had a filling in this tooth. This is kind of where maybe the filling in its entirety used to be. This is what was the residual amount of filling, and so kind of this space in between is where, there's a complete loss of enamel, and so then the tooth, through force, is able to kind of flex, this way and this way, kind of leading to, kind of cracks in the tooth. I bet you had a very similar situation to this kind of tooth here that's had the crown on it there. But ideally, we want to see points of contacts, almost like gears of an engine, where we just want our contact points kind of be here and here on a lower tooth. I don't know if you can really appreciate this, but you have a lot of surface wear through these facets, all kind of right here. And so, these teeth, this tooth just gets a lot of force on it, which can kind of lead to, kind of these problems. But this is the tooth when we initially remove that filling. Can't really appreciate it too much here, but this was a little crack that was kind of going here. You'll kind of see it in another picture from the enamel here. But what will happen is, this cusp flexes and then problems kind of arise. And so with biomimetic dentistry, we're trying to, again, just remove the problems, decay, cracks, while preserving the natural enamel and dentin of the tooth and rebuilding it using materials and techniques that kind of mimic it to move together. And so this is just one of the steps where we'll use what's called caries detecting dye. This just only stains, weak part of the tooth, and so it gives us a good, clear, objective measurement for that. So this is a good picture here where we got a couple of things going on. This was where that crack was spreading into here, and we removed it. It's okay to have a little crack in enamel right there as long as it doesn't spread into here. So we removed it here, and then so we can bond to all that. Enamel's got a great bond strength here, but our goal with Biomimetics is, again, we're going to build the tooth from the inside out. We're gonna use some materials and techniques to have a strength of 50 here, and then on the outside here, it's gonna be kind of 30. And so, again, we want a stronger inside than outside, and that what separates biomimetic dentistry from most other kind of techniques. So this is a good picture here, where we just kind of have a material that mimics the dentin of the tooth. We kind of put a little ribond here. You really can't see it because it's just blending in with the material, but see a little bit right there. That's the ribond. That'll kind of have like a Kevlar casting effect on that crack. The shininess that you see is just our initial layer of the bonding agent. We use what we consider gold standard bonding agents. There's only 2 that have 30 years of a kind of clinical track record and success. And again, it's just our commitment to using the best materials and techniques that we are aware of to give us the best result that we can. And so from here, we're just using, again, another material to mimic the enamel of the tooth, rebuilding it back to kind of contour, shape, and form so that it kind of looks good and feels good. Again, this is just the final kind of tooth here. And so we have now a tooth that's, say, decay-free, crack-free, and rebuilt in such a way that hopefully it'll kind of stay problem-free for a very long time. And so kind of hope you found this of value. Of course, if you have any questions or concerns, just don't hesitate. Let me know. Always good talking to you, and always respect people that take an active role in their health care decisions. So hope you have a good day, and we'll talk to you soon. See you later, Sheree.